Hi, everyone. Welcome back. Today, we're joined by Dr. Eddie Stenehjem to give our weekly COVID-19 update for the community. Before we get into case trends, Eddie, welcome back. It's great to have you back for the Facebook Live. It's been a bit since we've last seen you, so welcome back.
Thanks. Yeah, it's been a month and a half, so it's good to be back.
So before we jump into those case trends, I just want to talk about a reflection of the last year. It's been about a year since Utah kind of shifted into more of this closed businesses, restrictions. I remember last year around March 17th, the ski resorts shut down, which was kind of a signifying day to me that we were changing pace of what was happening. So I'd love your reflection on kind of what the last year has meant to you, and also I know that you had a baby around this time last year. So let's talk about that first.
Yeah, there's a lot to reflect on. And, for me in particular, because my son was born March 21st. And the reason I've been gone for the past month is I took a very delayed paternity leave. And so my son was born, the pandemic was starting in full force, just couldn't get away from work, and it wasn't until February that I was able to step away and take a month with my family. So I've been enjoying a nice month away and was being able to unplug. And it's a time that I needed to do for myself and for my family. And it has been a really hard year. And thinking back this week last year, March 11th, Rudy Gobert tested positive. It felt like everything was shifting below our feet, and coincidentally it did. March 18th we had the earthquake, and that week was for us really full of anxiety and fear. We just didn't know what was to come, but we knew that we were in for a significant change, and that we knew that it was going to be a long haul, and that fear of the unknown and the fear of like what the impact was going to be. And so we've come a long ways from that time. And I remember we started doing some of these things shortly thereafter. And I just remember not knowing so much, and just looking back on reflecting like what we've learned about this virus, how far we've come in terms of the communication and our treatment and vaccines. I mean, if you would have asked me, this time last year, do you think you would be fully vaccinated against this virus in a year? I would have laughed and said that's absolutely impossible to be able to do that. So it's pretty significant what we've been through, and how much we've all suffered. And so it's kind of a solemn time to look back and reflect on that, and kind of hopefully now have a much brighter future to look forward to.
Yeah, it is crazy how much has changed, including our case counts and everything that has happened in the last couple of months. So I'm going to dive really quickly into those. Our total case counts for the state of Utah are at 380,340. Yesterday's daily case count was reported at 560, which brings our rate to 7.45%. Our total deaths in the state of Utah are at 2,041, with 5 reported yesterday. Our hospitalizations are at 189, and with vaccines, I'll just read out a few numbers. The total number of doses given, first or second dose, is at 1,080,039. That first dose is at 714,049, and fully vaccinated is at 394 and 4. These numbers have changed a lot since the last time you and I chatted, and even since last week, especially those vaccine numbers. But the first thing I want to focus on is this slight increase in cases and hospitalizations that have happened in the past week. Is there any sort of concern for this? And what do you think is actually contributing to that slight increase that we're seeing?
Yeah, I think focusing on the case counts is important. The hospitalizations, I'm not sure if this is just a little blip or what we're going to see with that. We saw this really nice ongoing trend down in our case counts. We've then subsequently plateaued, and now I think we're starting to see a slight increase in cases. And Utah's not alone in that. There's about 15, 20 other states in the U.S. that also saw this nice decline, plateau, and now an increase. And so Minnesota, there's plenty of others that have done that. And so we are seeing this increase And we're going to have to watch that really closely. When you look into the data and the demographics of the people within Utah, it looks like it's the younger population that are seeing a slight increase, at 15 to 24-year-old age group, and the 1 to 14. We're starting to see a slight uptick in that as well. And so we'll have to watch that really closely. I worry, and just it's probably the case, is that we're all letting our guard down a little bit. The weather's getting nice, people are getting vaccinated, you may be vaccinated or somebody you know has been vaccinated. You're starting to increase your social circles a little bit, and that's going to lead to increase in transmission. And so we do have to follow that really, really closely as we move forward here in the next couple of weeks. We got to keep in mind that, yes, vaccinations is going really well, and it's going faster than we expected, both at the national level and also in the state of Utah. And they're going to go faster as we get much more supply coming in April. But we're not there yet. We don't have the masses vaccinated to the point that we have any kind of protection from a herd immunity standpoint. We're just not there. And so we're getting close. It's a really optimistic time right now, but we're not there. And so I think we just have to be really, really careful not to declare victory before we're actually at the finish line here. And so it's something that I worry about, certainly as we progress and before the vaccines get fully widespread.
You mentioned this increase in that 15 to 24 age range, which brings up kind of a question for you. The state announced yesterday that we are opening up all vaccines to adults 16 plus starting next Wednesday, March 24th. What are your thoughts on this? Do you feel like this will help us move towards that immunity that we're looking for? Does it feel like it's too soon? What are your opinions on that?
No, I think, it's great that we're opening up to, people to essentially all people above age 16. And, when we look at the demographics of people getting vaccinated, we have such great vaccine coverage in the 65-year-olds and plus. That's above 70%, 80% those that are above 70 years old. Folks above 60 is getting up to about 50, 60% as well. So we're really making great strides, especially in those people that are at highest risk of hospitalization and death. And now we're able to open up because we've got availability. Granted, not everybody that wants a vaccine that's above age 16 is going to be able to get one next Wednesday. People are going to have to be patient. They're going to have to go through the system. They're going to have to get an appointment. It's going to take a while, but it really does improve the access to vaccines for everybody in Utah. And it's just, we have to get people through, get the vaccine supply, and really, really encourage people to get out and get vaccinated. Vaccination is the way that we, find ourselves out of this. If we can protect enough people to get to that quote unquote herd immunity, what happens then is, even if the virus comes into our community, it's got nowhere to spread, so you don't have ongoing transmission. And so it is so critical that we get as many people vaccinated as soon as possible, and that really will stop the transmission of this virus and allow us to get back to the lives we're used to living.
An interesting note too on that, there's been some articles that have come out about the low percentage of Utahns that have actually been vaccinated in total, not just those eligible groups. And I think it's important to note that one of the reasons for this is Utah has one of the youngest populations in the country. So that change in 16 plus will vastly adjust how many people are vaccinated. I think the last report was about 16% of the population in Utah is vaccinated, which is pretty far away from that herd immunity we're trying to achieve. Do you feel like we moved too slow with the other age ranges? Is this all good news that we're kind of opening this back up? Does that number really matter, or is it going to drastically change in a couple of weeks?
No, I think, the main focus, which is what Utah did, was to focus on the people that were the most vulnerable to severe disease. How do we prevent death? How do we prevent suffering in the hospital on a ventilator or alone in a hospital room? And that is our number one priority. And who are those people? Those are people that are advanced age that have and also have medical comorbidities. So that's our number one priority. It always will be, is to really prevent severe disease and death. And to do that, you got to go and vaccinate the older population and those with medical comorbidities. So absolutely, and clearly the numbers demonstrate that there's been an incredible uptake in that population of people that meet those categories. So I absolutely think that was the right thing to do. And you see it in our hospitalization numbers, right? You see this incredible dramatic reduction in hospitalized patients. And I bet, I don't have this data, but I bet if you looked at the average age of the hospitalized patients, I bet that number has gone way down, because those older people that are fully vaccinated aren't getting hospitalized. It's likely those younger people that hadn't gotten vaccinated yet. So I think targeting the older people and those with medical comorbidities is absolutely the right thing to do. But now it's time to really open it up and get everybody protected. So then you really can reduce transmission, right? Transmission amongst young adults, transmission amongst older people that don't have medical comorbidities. That will really improve the community health moving forward.
I want to talk about that word transmission. There's been a lot of conversations and questions around whether the vaccines can actually help prevent transmission. Last week with Dr. Venta, we talked about a study coming out from Israel that talked about it, and the fact that the Pfizer vaccine, which is mostly what their country has been shown to actually stop or slow the spread pretty well of COVID. Have we learned anything more about what the transmission is actually like with those who are vaccinated?
Yeah, so we're learning more and more, as the weeks go by, and the Janssen vaccine or the J&J vaccine had some data on their vaccine, which is a different, vaccine than the RNA vaccines in terms of Pfizer and Moderna, but it's the same, essentially sequence that we're generating an immune response to. It's that spike protein. And so we do see in the trials with Janssen, which was this multinational, double-blind, randomized, placebo-controlled trial, that it actually, prevented people from getting asymptomatically infected at, pretty significant rates. That coupled with the data coming from Israel showing, very significant decreases in transmission with about 50% of their population vaccinated, really is some optimism for us that the vaccine will not only prevent, moderate to severe disease, but it also may prevent getting infected at all, asymptomatically or mild disease, and thus prevent transmission. And so we don't have any definitive data at this point yet, coming from the US, coming from Utah, but the things that we're seeing from the Janssen trial and from the Israel data is looking very promising. It's not quite there yet to be able to then use that to make recommendations in terms of, if I get vaccinated, can I do things differently in terms of masking and that? Not there yet. That said, the data looks optimistic, and we're hoping to have more data, coming in the weeks.
We just got a question too around having to get the shot yearly or bi-yearly or however it ends up being. Do we know anything more about that and whether it's going to be a repeat vaccine that we're going to need? Are we going to need a booster in 6 months? I know that there is the Pfizer and Moderna are looking at that, but has anything else come out about those pieces?
Right. So the way you want to think about this is that these phase 3 trials that got approval for Pfizer and Moderna and J&J and then AstraZeneca and Novavax, in Europe, the data for that was an average of 2 months of follow-up. And so those trials at the time that got approved didn't have data on how long immunity lasts. Those people that are in those trials for 2 years. And so they're going to be monitoring those participants for 2 years, and they're going to be looking at when those people, if and when those people start getting infected with COVID after they got their vaccine. And so we're going to get data from those trials in terms of how long does immunity last. The other thing that we're doing here in Utah and across the US are things called vaccine effectiveness trials. And so these are trials that look at how well do these vaccines work in real world, outside of a double-blind, randomized, placebo-controlled trial. But how well do they work here? It's with those trials that we can actually start getting a sense of when does the vaccine immunity wear off? Okay, so boosters can be used in 2 ways. One is to boost your immunity as it's declining, And so then you'd get another shot of whether it be Pfizer or Moderna to then boost your immunity. And so you're back up at those levels. You can also use a booster shot to account for changes in the virus. And so maybe your immunity is still high for the virus you got vaccinated for, but these variants now are here. And so maybe we give you a vaccine booster to get you immunity to this B117 variant or the P1 variant or the California variant. And so when we think about boosters, it's either to increase your immunity because it's waning or get you new immunity to a variant that is circulating. And that's why we do influenza shots every year, right? It's because there's mutations in flu and you need to be covered for the new mutations. So at this point, if I had to look into my crystal ball, I would say that, yeah, most likely there's going to be some kind of booster in the future, likely directed towards a variant, and that would also potentially boost immunity. Do I think it's going to be this fall? Probably not, but it very well could be, after that. But this is going to be something that'll be watched very, very closely through vaccine effectiveness studies and these big, large clinical trials.
I want to talk a little bit more about those variants too. There has been reports that we're seeing more of those cases specifically in Utah. Is there any concern that we are seeing more of these? And if there is, what do we need to do to kind of fix this or stay on top of it to make sure that the UK variant doesn't become the normal variant here in the US?
Yeah, so if you look nationally, what you're seeing an increase in variants across the US. And the variants that we're currently seeing in bigger numbers is this UK variant or the B117 variant. And then the other next most common variant is the California variant or the B1427 or B1429. Those numbers are irrelevant, but yes, we are definitely seeing, increases in variants in the US. We're also seeing it here in Utah. The challenge is that the data that you have to get to what is called genotype the virus. So you have to go and you have to essentially say, what are the genetic code of the virus to see if you have the variants. That's laborious. It's relatively slow and the data is delayed. But yes, we're absolutely seeing the B117 variant here. We most likely are also seeing the California variant here. The good news on that is that both of those variants seem to be responsive to the vaccine. Both of them are more transmissible than the original virus, but they're both susceptible to the vaccine. And so that tells us, as long as we're strong on our vaccine delivery, as long as we can make sure people can get vaccinated, then we're going to protect ourselves against those variants. And so it truly is kind of this race of vaccines versus variants. And fortunately, the vaccines cover these variants. They protect us from these variants. But it really is, we got to get people vaccinated so we prevent those, that transmission of a higher transmissible virus in our community.
You actually answered one of the questions we just got. If there's any cases of people who are vaccinated getting infected with the variants. I don't know if you know any more specifically about that, but it sounds like so far they seem to be effective against it.
Yeah, and so when you look at the data there's a number of different ways you can look at this, neutralization assays. You can look at obviously how well these vaccines are effective in populations that have these variants. You can also look at reinfection rates as well. From everything that we're seeing, the B117 and the California variants, we're protected from them with our current vaccines. One of the things that we'll be very keenly following and watching for are people that get infected after they've gotten vaccinated, particularly after a week goes by after their second dose from Pfizer and Moderna, or 14 days from J&J. And so we really want to look at those vaccine failures and say, okay, those are people we want to make sure that we can get their virus and genotype it to see if we're seeing novel variants here in Utah. We're not just susceptible as a community to the variants that came from UK or South Africa or Brazil or California or Oregon or New York. We're susceptible to variants that are developed here in Utah. And so that's what viruses do. They mutate. And one way to prevent mutation is to just decrease the amount of viral transmission in the community. And so it's going to be really important for us to decrease that burden. And then if we do see these vaccine failures, is to get them over to the Utah Department of Health lab to get them genotyped to really say, hey, why did this person's vaccine fail?
We just got a really interesting question around children and the vaccine. This person specifically said, how open can we be with our children since there's no vaccine specifically for them? Are they safe to play in each other's homes without masks, or should we wait until those people are vaccinated as well? And is there a bigger risk for the variants in the younger population who are not vaccinated? So I'm assuming this is 16 and younger for this question specifically.
Right. So vaccine trials are ongoing in children, and they will be starting vaccine trials with the other candidates, moving forward. So I know AstraZeneca is looking for a trial. There's going to be a lot of trials coming up in children for one. We know that children can get infected, and we know that children can be symptomatic, and we know that some children, albeit rarely, can get severely ill. We also know that children can develop long COVID or post-COVID syndrome. We don't know a lot about it, but we know that it certainly can happen. And so we can't say that children are immune to this. They are in general less affected in terms of the severity of illness, which is so fortunate. And so I guess when you think about children and their play, because schools are still going to require masks, and that's absolutely 100%, important. When we think about play, I would say really focus on getting the kids outside. And as our community transmission goes down, so as the amount of disease in our community goes down, that means our children are less at risk, just like the rest of us. And so I would say at this point, if you're going to be having children play in close quarters, particularly inside from different households, yeah, I'd still wear a mask at this point. As the summer comes, as spring moves on, we move into warmer weather, I'd say at that point, you can get the kids outside. And I would say in the not too distant future, they probably can play, without masks, because when you're outside and our community transmission is low, well, hopefully will be lower as more and more people get vaccinated. And so I think at this point, I would still err on the side of caution, because we know that kids can get sick. And so indoor play, absolutely wear masks, especially with kids from different households. But then once things warm up and our cases go down and we can be outside, I think, in the not so distant future, we could be thinking about maskless play for our kids.
Is there also any indication on when those children under 12 can actually get the vaccine outside of the clinical trial? There's been different reports of different days, but do we know anything more about that?
We don't. It'll be a little bit, those clinical trials have to fully enroll, which is going to be harder, right? Because it's a smaller population of people that are trying to enroll. So that's one. And, as our cases go down, which is a great thing, that reduces the chance of getting infected. And so the clinical trials will have to run until they see a signal. And if there's lots of cases in the community, there's lots of ability for people to get sick. And so your signals in those clinical trials occur faster. And so it's going to take longer for the clinical trials to be able to get a signal to see if they work or not. And so it's going to be, I think we're going to be a bit, but, maybe by this fall, if I had to, actually put my nickel down and give an estimate.
Last question for you. So we know that the statewide mask mandate is ending on April 10th. What are your suggestions to those who still want to wear a mask or still have concerns? What should people be thinking about when that statewide mask mandate ends?
Yeah. So things that we know that masks work. We've seen plenty of clinical trials. We've seen plenty of observational studies to show the importance of a mask in reducing transmission. And it's important to reduce transmission from you to somebody else, and it also protects you as an individual. And so, I can tell you that I'm going to be wearing a mask April 11th and moving forward. I think people are going to have to, make their own call on this, and realize that even at today's rate, the level of virus in our community is still at a high level. And so if you look at CDC data and CDC recommendations, that 191 over 100,000 case rate is still in the substantial to high category. And so, even if we get below that and the mask mandate goes away, we still have high levels of transmission based on the CDC categories. And so I would say, continue. My advice is going to say, continue to wear a mask where you're around other people, and then especially when you're indoors. That's just something that we feel is something that protects the safety of you and the others around you. And I'd say continue to do it. And I think people will. I think masks has become kind of a social norm at this point. People are comfortable with it. When I leave, I grab my phone, my keys, and my mask, and it's just kind of it's become normalized. And my recommendation would just say continue to wear those masks in those places that you're around people and you can't social distance, and absolutely just put it on. It's it's the one thing that doesn't cost anything. It doesn't affect the community in terms of an economic standpoint. It allows things to remain open, and so my recommendation would be to continue to wear the mask.
Quick question for you on that too. Intermountain announced today also that we are going to be continuing to require face coverings and masks in our facilities beyond that April 10th measure. What does this mean from a healthcare perspective? And do you feel like patients are going to feel more comfortable coming into our hospitals when masks are still required?
Right. I mean, we had a mask requirement in our hospitals, in our clinic facilities, well before any kind of state mandate. We did it because masks protect patients, they protect caregivers, and they protect visitors, just plain and simple. And so the reason why we're going to continue to have a mask mandate within our Intermountain facilities is because we feel that it's our duty to protect patients and staff and visitors. And we'll obviously continually to monitor that and to evaluate our numbers and evaluate the risk to our caregivers, our patients, and our visitors on an ongoing basis. We do that weekly, and we'll pull that back when we deem that it's safe for all those involved. And so the reason we do it is out of abundance of caution and to make sure that the patients that are coming in, the most vulnerable patients in our community, the ones that are seeking care in hospitals and clinics, those people deserve our safety. And that means us wearing a mask to protect them.
I think that's great. And I actually do have one more question for you. Someone just asked us this. They received the first dose of the Moderna, and their company is now giving the Johnson & Johnson vaccines. Can people mix and match vaccines?
No. Would not recommend to mix and match. If you started with the Moderna, you absolutely should get your second shot of the Moderna, and you should not convert to the J&J vaccine. So not to say that at a point in the future we may mix vaccines of the same platform, Pfizer and Moderna is the same platform, for example. But at this point, I would absolutely not mix vaccine types. If you start with Moderna, get your second shot of Moderna, or get the one shot of J&J. I would not mix the two.
Thank you. That's great advice. Dr. Stenehjem, is there anything else you want to mention today before we take off?
No, I think we're at a really good spot right now. It feels really good to be optimistic. I really think this next month is our time to really continue to focus on the things that we've done that we know work. We know masks work. We know that minimizing your contacts work. And if we can get another 2 to 4 weeks in with decreasing counts because people are getting vaccinated, because people are wearing masks, because people are minimizing their contacts, that gets us into the end of April where the weather's nice, we can get outside, we can socialize outside, we have, universal vaccine availability. In a month, we're going to be in a great spot to really be thinking about, okay, how do we truly open up? And so, I really think that if we can just continue to focus on what we've done for the last year, we've done this for a year, we can do it for another month. And that, if we can do that, I think that's going to allow us to really, have a much better summer. The last thing I want to see happen is that these case counts go up over the next, 1 to 2 weeks. I don't think they're going to get to the levels that we were back in, November, December, January. But the last thing you want to see is those levels go up and us having to like really double down again. And so I really hope that we can all kind of, continue to do what we're doing, that we've done for the past year, to make sure that these case counts stay low, get lower, get more people vaccinated, and then we're going to be in a much better spot come, Memorial Day.
Looking forward to that. Dr. Stenehjem, thank you so much for joining us. And if you're watching and would like to get an appointment for the COVID-19 vaccine, you can go to intermountain.com/COVID vaccine. We release new appointments on a weekly rolling basis. So just make sure you keep checking back, things change. And it also talks about what facilities are giving out what vaccine depending on the day. If you are interested in getting tested for COVID-19, we still have that available. You can go to intermountain.com/COVID testing. Fill out a quick survey and you'll be prompted to choose an appointment arrival time for that. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. It's a free service to the community, and that phone number is 833-442-2211. Thanks again, Dr. Stenehjem, and we'll talk to you later.